Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your question on injuries, training, rehab, or technique. We'll be taking your phone call shortly. Call 856-767-8884 or toll free 888-634-7488 for your direct line to Sports Doctor. Now here's your medical reporter for tonight's show, Joe Chapana.
And good evening. Welcome to Sports Doctor. Sports Doctor is brought to you by Cross Keys Physical Therapy Sports Medicine Center in Woodbury, Washington Township, and Pennsville. I'm Joe Chapana. Tonight we're going to be talking shoulder injuries. It's a complicated joint and also the source of a lot of pain. If you're having pain with your shoulder, you have some questions for us tonight about your shoulder, call us toll free at 1-888-634-7488. We look forward to hearing from you tonight on Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. Tonight, answering your calls, we're pleased to have Dr. Merrick Wetzler. He's an orthopedic surgeon with South Jersey Orthopedic Associates, located in Washington Township and Voorhees. Dr. Wetzler specializes in sports medicine, shoulder and knee reconstruction, orthopedic trauma, and general orthopedics. Next to him is Dave Anselmo. Dave Anselmo is a physical therapist and the owner of Cross Keys Physical Therapy Sports Medicine Center in Woodbury, Washington Township, and Pennsville. Special occasion tonight.
It's true. I'd like to wish my wife a happy 10-year anniversary. And like with two beautiful children, Alexis and Ashley, and I'm looking forward to many, many more.
We were talking before the show how long we've been doing this program.
Right, a long time.
Because I remember when you were married.
It's true.
You actually took a night off.
Too short.
Was your brother still on the couch back then, too?
Yeah, he was in Florida on the couch then.
Okay.
Brother George watching the program from his couch. Anyway, our toll-free number is 1-888-634-7488, and we are going to be talking about shoulder injuries tonight. Dave, why don't we do the shoulder joint?
Sure. Let's do anatomy here. This is the arm of the humerus. Goes into the humerus. There's the head of the humerus right here. Glenohumeral joint. It's the clavicle, better known as collarbone. Scapula, better known as wing bone. Okay, this is the AC joint, coracoid clavicular joint. It's the acromion process. It's the coracoid process right here. All right, let me go through the muscles of the rotator cuff. This is the supraspinatus, infraspinatus, and teres minor. Right there. Those are the major muscles of the rotator cuff.
All right. I know we'll be getting calls about the rotator cuff tonight.
I wanted to,
a couple more
forgot
things
one.
there.
I forgot one thing
Sure.
here. This is the glenoid. This is the labrum. This is the labrum. We always talk about the labrum, and I forget to point it out all the time. That's the labrum.
All right, the anatomy there. I think we've got a phone call already on Sports Doctor tonight, brought to you by Cross Keys Physical Therapy Sports Medicine Center to Pennsville. John, welcome to Sports Doctor. What's your question for us tonight?
Hi, my question is for Dave. I want to wish him a happy anniversary, and I want to tell him I'm a patient of his. I go to Cross Keys. I've been there for 3.5 weeks. Now, I know you're talking shoulders, but I have knees. I had 2 total knee replacements. Dave has me walking. After 1 week with Dave, I throw away the walker. 2 weeks with Dave, I throw away the cane. 3 weeks with Dave, I'm walking. And I got a challenge for Dave. Hey, Dave, I only have 6 to 8 more weeks. I want to be 100%, baby. Will you accept that challenge and just kick it up a notch?
Okay, John. Thank you for calling, John. John is actually the manager of a big, one of the best classic rock bands in South Jersey, SJ4, John. So check it out. Thanks for calling, John.
SJ Ford. Okay, maybe we'll have him play on the program. So
that'd be great.
That'd something to look forward to.
House band.
Yeah,
SJ4.
We need a house band on this program.
There you go.
Dr. Wetzler agrees. 1-888-634-7488. Is it Denise? Is that the next caller's name? Denise, I'm sorry. Denise, welcome to Sports Doctor. What can we do for you tonight?
Thank you. I was recently diagnosed with a frozen shoulder, and I was wondering what you would recommend for something like that.
Okay, frozen shoulder.
Well, frozen shoulder, what we call another term they call it called adhesive capsulitis. What happens is slowly over time, we're not sure exactly how it happens, the shoulder scars down and you build up, and the shoulder slowly but surely freezes so that you have decreased range of motion of the shoulder in all planes. The treatment for that, it comes on very slowly, and I tell my patient it goes away even slower. We try cortisone injections, followed by a significant amount of physical therapy. If that doesn't help, then we actually take you to the operating room, put you asleep, and manipulate your shoulder under anesthesia to break up the scar tissue. But our initial line of treatment is physical therapy, and it takes a long time, and it's a slow process.
Yeah, what about the physical therapy for that,
Physical
too?
therapy is very important. Obviously, you really need to be very aggressive with the physical therapy with adhesive capsulitis, like the doctor said, because it's scar tissue binding down. The physical therapists will usually do ultrasound, which breaks up collagen, which the scar tissues are made up of, and they do a very aggressive stretching and joint mobilization. And obviously, as you're getting your range of motion back, they're working on strengthening. So, but once again, it's not comfortable. There is some pain involved in it, but that's what goes with the territory. You have to get it back as quickly as possible, because if not, you're going to run into we have to get manipulated, and then you're back into therapy anyway. So.
All right, Denise, good luck with that. Thank you for the phone call. Let's talk to Chris now in Philadelphia. Chris, you're on Sports Doctor. What's your question for us tonight?
Hi, I'm an avid runner. Unfortunately, I joined a gym, and I was doing the treadmill, and I think I was going probably a little too fast. And I have an appointment scheduled with the Rothman Institute, but if you know those guys, it takes forever to get in with them. So in the interim, I think I did something to my gastrocnemius muscle. It hurts right on the front of my shin, and I guess you're not going to be able to tell me if it is or not.
Well, I mean,
I'm sorry to interrupt you. If it's on the front of your leg, then it's probably not a gastrocnemius. I mean, you can, pull your calf muscle, as people say, and that's mostly posteriorly on the back of you, on the inside back usually. You can swell, sometimes you hear a pop when you do it, and so forth. If you have been on the treadmill a lot, pounding, and you're running a little bit of incline, and your sneakers are not the best, you might have developed some shin splints or a stress fracture. Anyway, you see, I'm glad you got an appointment. I think you need to follow up that appointment and see what they have to say. They might want to do a further workup, especially if they think it's a stress fracture, such as an MRI or a bone scan.
All right, thank you for the phone call. Tonight we are talking shoulders tonight on Sports Doctor, but occasionally we get sidetracked, and that's okay. Yeah. Our toll-free number is 1-888-634-7488. We're all about you, is the point tonight. We've got a caller from Wilmington. Chris, another Chris. Welcome to the program. Chris, what's your question for us?
Yes, I have a torn rotator cuff. I was wondering how long it would take me to be rehabilitated after surgery.
Okay, the torn rotator cuff.
Well, it depends on what's done. If it was done open, usually start therapy fairly quickly. If it was done arthroscopically, then usually wait 4 to 6 weeks afterwards to start therapy. And depending on how large the tear is, I mean, if it was a small tear fixed easily, you can be back in 12 weeks. But if it's a large tear that they had to put multiple devices in to fix it down, depending on the quality of tissue, depending on the amount of arthritis in your shoulder, and depending on what other pathology you had, it could take you up to six months or longer to get back. So it's hard to say exactly what. I mean, Dave can comment on the spectrum of patients out there.
Yeah, it's really important, and obviously people ask me this question all the time, and the biggest thing I tell you, it really depends on the orthopedic surgeon, and because he or she is the one that's really inside of your shoulder and correcting the problem. Like you said, it could be a full thickness tear or a minor tear, or it could be 2 tears. It really depends on how severe the injury is, the tear is, and how secure the surgeon does inside his sutures, where he uses anchors or whatever he needs. And he really dictates how quickly therapy starts and how soon it's going to stop. But more importantly, I should say more important than that, but it's also important on your conditioning prior to having the surgery too. As we know as therapists that people that are in very good condition prior to having the surgery rehab back faster for obvious reasons, better blood supply, better flexibility, better muscle tone, better strength, and probably another one is better attitude toward exercise, which is really important when you come into rehab. You got to like the exercise when you come in there because you've been doing a lot of it. Also, as well as that, you need to be able, does the patient come in 3 times a week or 2 times a week as the orthopedic surgeon or the physician tells you to come in? And last but not least, does the patient do the home exercises as the physical therapist describes? All these things combined makes a big difference on how quickly you're going to rehab. And so a lot of it comes back on you as well.
All right, Chris, you got a road ahead of you. Our toll-free number is 1-888-634-7488. We're talking shoulder injuries. We have John from Forked River. John, welcome to Sports Doctor. What can we do for you tonight?
Okay, I had an injury some years ago, and I developed, I guess, arthritis and a bone spur in my shoulder. And I've tried physical therapy, and there's limited range of motion in the shoulder. I just wanted to find out if the bone spur was something that could be removed, or...
Okay, what about the bone spur, Dr. Wetzler?
It depends where the bone spur is, but if it's what I'm thinking, it can be easily removed. We do that routinely in shoulder. When you talk about rotator cuff tears, you talk about rotator cuff tendonitis. A lot of times we do surgery just for rotator cuff tendonitis. What happens is that your rotator cuff from overuse gets inflamed. This space right here between the rotator cuff and the acromion and the coracoacromial ligament, it's finite. It does not get any bigger. Nothing we can do non-operatively will make it bigger. So as if you get scar tissue here, it's going to pinch more here so that more inflammation, so it's going to be more swollen, so it's going to pinch more. So you get this feedback loop, and if you get enough inflammation, you develop scar tissue. No matter what we do, we can't reduce that scar tissue, so what we got to do is open up the space. You can develop a spur on your acromion, so we shave that down, we release this ligament, and we open this space. So that's a lot of times what you hear about when they say, oh, I had a spur in my shoulder and they cleaned it out. That is what we usually do. We do what we call a acromioplasty, and we release the coracoacromial ligament.
All right, John, thank you for the phone call. You can reach us too at 1-888-634-7488. Shoulder injuries, our topic tonight on Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. We've got a caller from Mount Laurel, Sharon. Welcome to Sports Doctor. What's your question for us?
I'm calling for my sister. She has a fat deposit between her shoulders at the base of her neck. I was wondering if it was beneficial for her to have that removed, since she has pain going down her arms and shoulders. She can't really have range of motion where she should.
I mean, it's hard to say. I mean, she needs to be worked up. If she's had what they call a cervical disc, and that's pinching on the nerve, then you need to treat that. And it sounds like she might have that. You can have lipomas anywhere in the body. I'm not sure if that's what you're talking about. You could have different structures, abnormal structures pressing on the nerves coming down from the neck. That could be that as well. What I think you need to do is get evaluated by an orthopedic surgeon or a neurosurgeon and get looked at and see what they have to say, and then make your judgment from there.
All right, we're getting a lot of good calls tonight. We want you to keep them coming. We're talking shoulder injuries. If you'd like to, for us to discuss your shoulder, our toll-free number is 1-888-634-7488. Before we move on, though, I want to tell you about Cross Keys Physical Therapy Sports Medicine Center. They have 3 locations in Woodbury, Washington Township, and Pennsville. They're offering free screenings for the next 2 weeks. To take advantage of this offer, call the center nearest you. Again, the number's on your screen for their offices in Woodbury, Washington Township, and Pennsville, and you can get more information online at crosskeystherapy.com. Again, we are Sports Doctor. We're here tonight talking shoulder injuries. Call us now at 1-888-634-7488. We'll talk to you right after this short message.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
The specialists at the Rothman Institute are experts at fixing the bones and joints in your body, all designed to get you back to the normal, healthy, and active lifestyle you deserve. What do you want to do? Call 1-877-805-9292 and let the most trusted name in orthopedics help you today.
It's now all your son. All right, we're back on Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. We're just talking that all their centers have aquatic therapy, and we'll probably talk more about that in just a little bit. But Cross Keys is located in Woodbury, Washington Township, in Pennsville, offering free screenings for the next 2 weeks. We'll give you numbers to take advantage of that offer. Let me introduce you to our guest again. If you're calling tonight about shoulder injuries, you'll be talking to Dr. Merrick Wetzler. He's an orthopedic surgeon with South Jersey Orthopedic Associates. They're located in Washington Township and Voorhees. Dr. Wetzler specializes in sports medicine, shoulder and knee reconstruction, orthopedic trauma, and general orthopedics. Next to him, Dave Anselmo, celebrating an anniversary tonight, 10 years.
Yes.
Physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center, again in Woodbury, Washington Township, and Pennsville. If you'd like to reach us with your questions about shoulder injuries, we're at 1-888-634-7488. Our next caller from Hamilton. Is it Anna? Anna from Hamilton. Go right ahead with your question on Sports Doctor.
Yes, there's pain, I think right where the shoulders, there's the pecs, I guess the insertion or origin there, and then the biceps. So there's pain on both sides, both muscles. My doctor told me it was either because of carrying too much weight, it might have been a muscle injury. I'm just wondering how long it would take to recuperate from that. I'm fine, I carry things, but at one point, after carrying for too long, I can't carry a lot.
It depends on exactly what's going on. It could be the pectoralis muscle inserts right here in the shoulder. You have your biceps right here. Yeah, you can see. So you can see that the insertion of your pec is right here, and the biceps tendon is right there. So it depends on what's going on. I mean, whatever it is, it sounds like you have fatigability of the muscles as well as pain and probably some tendinitis. It would be beneficial for you to do therapeutic exercises and take some anti-inflammatories, ice your shoulder after activities, and I think that might be helpful. You can take advantage of the free screenings and get some help on the exercises and so forth, or you can see your family doctor and get referral to see an orthopedic surgeon.
Is this something where building up those muscles would help, Dave?
Yeah, it sounds like, as a doctor understands, it sounds like you have a little bit of tendinitis, which the tendon is where the tendon attaches the muscle to the bone, and when you're doing excessive weight, they sound like she's doing some lifting, you can put in too much stress on that area. It's usually called some repetitive activities with heavy weight is even more importantly, it could stress that area and create pain like she's explaining to us. So that's a possibility. So I'd like to take advantage of the free screening. We'll take a look at it and head you in the right direction, whether you need to see a surgeon or whether physical therapy will help you. But that's why we do the screenings.
Yep, and free screenings available at their locations in Woodbury, Washington Township, and Pennsville. We'll give you numbers for those centers throughout the course of the program. All you need to do is call and make an appointment. Right now, if you have a question about your shoulder, our toll-free number is 1-888-634-7488. Our next caller is from Ocean City. Bob, welcome to Sports Doctor. What's your question for us?
This is not a shoulder question. It's actually a middle back problem. I love to play golf, but it seems like every time I play, I wind up with these spasms, more or less. They feel like spasms across the center of my back. And I don't know what you can recommend for perhaps maybe before I start playing, any type of stretching exercises, or maybe afterwards if I should do any heat or cold. Is there any recommendations you might give me?
Okay.
If the pain and the spasms are between your scapulas, a lot of times that could be coming from your neck. So I think you need to get checked out. I think you should need to get your neck checked out to make sure that you don't have a herniated disc that can be causing referred pain down to that area. What happens is that from referred pain, the nerves are pinched up above, but due to the innervation of the skin and sensory dermatomes, they can cause pain in different spots. So I think you need to get checked out to make sure you don't have a herniated disc in your neck. which could be resulting from you playing golf and could be exacerbated by you playing golf.
All right, Bob, get that checked out. Thank you for the phone call. Our toll-free number, 1-888-634-7488. It's Sally, our next caller from Blackwood. Sally, what can we do for you tonight?
Yes, I had a acromial decompression back in January, 5 months ago, and it all went well. But the only question I have is in the front of my shoulder, kind of like toward the top, the joint or the bone is very sore. And also whenever I try to do exercises with a TheraBand, it hurts in the front of the shoulder. I guess the muscles, like almost where the rotator cuff muscles used to hurt, that still hurts. Is that expected at this time?
It's hard to say. No, not necessarily. It's not expected, but you could still have some biceps tendonitis if they didn't treat that as well, or you had the tendonitis that the doctor, even MRI imaging, could not find. Also, it could be you could have some arthritis in your acromioclavicular joint that wasn't, if it wasn't removed. So there's a lot of things that still can cause you pain. I think you need to go back to your doctor, let him reevaluate you, and come up with a game plan.
All right, and if you've been watching Sports Doctor tonight, you know we've been talking about the free screening offer from Cross Keys Physical Therapy Sports Medicine Center. They're located in Woodbury, Washington Township, and Pennsville. If you'd like to take advantage of the free screening offer, it's available for the next 2 weeks, call the center nearest you. Again, the numbers are on the screen for Woodbury, Washington Township, and Pennsville. If you want more information, you can also visit them online at crosskeystherapy.com. Tonight we are talking shoulder injuries on Sports Doctor. We have a few more minutes left in the program. We welcome your phone calls at 1-888-634-7488. Dial us up. We'll talk to you when we come back right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
The specialists at the Rothman Institute are experts at fixing the bones and joints in your body, all designed to get you back to the normal, healthy, and active lifestyle you deserve. What do you want to do? Call 1-877-805-9292 and let the most trusted name in orthopedics help you today.
Welcome back to Sports Doctor. I'm Joe Chapana. Tonight we are talking shoulder injuries, and we welcome your phone calls at 1-888-634-7488. Our guest tonight answering your calls, Dr. Merrick Wetzler, orthopedic surgeon with South Jersey Orthopedic Associates in Washington Township and Voorhees. And next to him, Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center, again in Woodbury, Washington Township and Pennsville. I believe we have a caller from Bridgeton, Robbie. Welcome to Sports Doctor. What's your question for us?
Yeah, doctors, I've been trying to get a diagnosis for my back, neck, and spine since 1999. I still have no diagnosis what it is. I've heard it could be Cushing's, lupus, fibromyalgia, bursitis, all kinds of things, degenerative arthritis. They throw me a ton of medication. I don't want to take the medication no more. But the pain starts in my left shoulder, and it'll move to the center, right, like in line with your spine, and it'll go either down or all the way to the right. When it gets to the right of my body, I can do nothing.
Okay, this is going to be difficult.
I mean, there's really nothing we can do for you over the phone. I wish there was. It sounds like you've had all the workup, all the appropriate tests, and so forth. But I think you should do is just... a pain management specialist might be beneficial, or start anew, go to someplace different, see a rheumatologist is someone I suggest you go to. Or,
It could be the fact that she has many things. I mean, not just one thing, and she's looking for just one diagnosis, and it might be a fact that you might have 2 or 3 or 4 of them. I mean, so it might not just be one. You're looking for one thing, so it's really hard to diagnose you over the phone, like Dr. Wetzler had said. But I would look for somewhere else to go to start looking for getting some of these other answers and try to sort some of these things out. But like I said, it might not just be one thing. It could be you have 3 or 4 things that you need to start addressing one at a time.
All right, Robbie, don't give up. Toll-free number 1-888-634-7488. Martin from Drexel Hill. Welcome to Sports Doctor. What can we do for you?
I have a torn rotator cuff, and I'm going on 93. So I saw the doctor yesterday, and he says you got 2 options. One is to, with the pain is bad, get another cortisone shot or surgery. But at my age, I don't know if it's worth it.
93 years old.
You just ask yourself one question. Does it affect your quality of life? If everything they do, the cortisones, therapy, anti-inflammatories, and you're still affected by your shoulder and affects your quality of life, and you're in good health, then you got to ask yourself that question. If it does affect your quality of life, then you should contemplate surgery. If it's not affecting your quality of life, and you can compensate and you can do your normal things, then you don't need to do anything.
Martin may be our oldest caller, but it's not.
93 is not old. Don't cut yourself short. You're young.
Exactly. It's really not. It's not a number. It's what you're doing at 93.
right.
And if you can't do what you're normally doing, then it does compromise your quality of life, and then it's an issue that needs to be addressed. All right, we're just about out of time here on Sports Doctor. I want to put the numbers up on the screen for Cross Keys Physical Therapy Sports Medicine Center. Please take advantage of this free screening offer. It's free. All you need to do is call the center nearest you. Numbers are up for their locations in Woodbury, Washington Township, and Pennsville. Visit them online, too, at crosskeystherapy.com. Want to thank Dr. Merrick Wetzler, our guest tonight from he's with South Jersey Orthopedic Associates, Washington Township, and Voorhees. Always doing a good job on Cross Keys Physical Therapy Sports Medicine Center. Sports Doctor. And we want to say happy...
Wait. Kids, time to go to bed.
Okay.
Just want to make sure...
Do we have his number? Do you have his number posted?
Do we have
up
your
there?
number up there?
I don't know. It's
Give him his number.
424-8866.
424-8866.
Yeah,
and
thank you.
Dave Anselmo, we've got to wish another happy anniversary.
Happy anniversary, baby. Love you.
10 years. 10 years.
10 short years. 10 short years.
Just seems like yesterday. Dave needed off to get married. Anyway, we'll be back a week from tonight with another edition of Sports Doctor. Until then, I'm Joe Chapana. Don't forget to stretch.